Natalie, I hear a lot of times that when it comes to healthcare, people feel like they're really just being treated for their symptoms or what's going on right then instead of, the whole body approach. And so that's one of our topics today is talking about integrative medicine. So we have Dr. Amy Offutt, an integrative medicine physician who helps patients with complex conditions reclaim their health. Good morning. How are you?
Good morning. I'm very well, thank you.
Oh, we are so happy to have you. For people at home who don't know, what is integrative medicine?
That's such a good question. I try to explain that to patients, and it's a little challenging to describe, but it's really the best of conventional medicine paired with therapies that are often categorized as complementary. Really, the emphasis is on prevention, life habits, and then also just connecting all the different body systems into one rather than just focusing on symptom management, which is more what the traditional medical model is based on.
So Dr. Amy, are you looking at a patient's symptoms and saying this could be the root cause of those things and this is what you need to do differently?
Definitely. In my practice, I treat a lot of complex chronic ill patients, and so I'm always looking for what happened to them. So the history is very important. I spend a very long time with each patient to try to sort out what happened to that patient to result in the symptoms that they've developed over time. And that's where a lot of good information is that we don't always have time to talk about in a shorter appointment. So most integrative practices do, I would call it more of a deep dive, looking at what happened to the patient, what's going on with the patient now, and how can we piece it all together to start to peel back anything that could be, optimized or treated to actually get rid of the symptom rather than just giving a medication to reduce the symptom.
Let me ask you this, what is one really common chronic illness that you're seeing, and how are you approaching that particular chronic illness?
So in the last couple of years, I've seen a huge rise in autoimmune diseases. And, it's a grouping of different diseases where the immune system basically starts to turn on the patient, and it may affect the thyroid, it might affect the digestive tract, it might affect the brain. I mean, it could honestly affect almost any part of a person's body. And I believe that almost every single autoimmune condition warrants an evaluation looking for an underlying infection or an underlying exposure. And when I go looking for those things, I often will find them. And once I treat them, oftentimes the autoimmunity can improve or be somewhat reversed. There's certain ones like type 1 diabetes is not reversible, but I have been able to reverse some autoimmune conditions in other patients like rheumatoid arthritis, like Hashimoto's thyroiditis, some especially GI-related autoimmune diseases like Crohn's or ulcerative colitis without the patient having to have surgery or take a lot of medication or, do other more drastic measures.
What typically is the most common fix for I know, it is integrative health, so like you're looking at the person as a whole, everybody's different. But if you were to pick one commonality, would it be people in general not getting enough sleep, not getting enough exercise, their diet? What is usually at the core in most cases?
I think of really 5 pillars that I try to not forget to touch on with every patient. Sleep is definitely extremely important. How people look at the world and their level of stress is extremely important in healing. Nutrition, of course, is very important, including hydration. So many of my patients don't get enough hydration, and it causes a lot of catabolism or breakdown. Things like, pain. People who don't manage their pain and sort of walk around in pain all the time are also going to eventually develop some sort of chronic health issue because it just starts to really wear on that person's health. And so, looking at the person as a whole, I think positive outlook is one of the most underappreciated ways that people can influence their own health outcomes. And it is sad, though, because I do see a lot of patients who have gotten somewhat discouraged and downtrodden with being prescribed a lot of medications, and now they feel stuck on the medications and they still don't feel, resilient and strong and capable of doing the things they want to do. So sometimes I start with that, where we work to see what medications can we replace or reduce, and even that can help people feel better.
Do you think because you're integrative medicine, are people hesitant to come to you because you aren't, the standard, I'm going to the hospital kind of office?
I think it depends on what a person wants. A lot of people, I find more and more, want a more well-rounded approach to health and healing, and they're not as interested in just being prescribed a medication. So if someone really wants that, and I can identify that early on, I will oftentimes say, there's a doctor down the street that does exactly what you're looking for, and I think you should go and have that kind of care. Whereas, the patients that want this kind of care, they're really enjoyable to partner with. I consider them a partner in crafting a strategy for healing. And I don't think people are afraid to come unless maybe their spouse makes them come. And then sometimes I can see early on it might not be a good fit, because you do have to work and participate. If you're going to get an integrative medicine consult, there's going to be some ownership and some work to be done with regard to cleaning some things up to make, for a better outcome. I wish there was a simple pill for a symptom approach that worked, but honestly, I don't think that really is all that helpful. Definitely, I use prescription drugs. I mean, I'm an MD. I was allopathically trained, and after about 7 or 8 years of practicing that way, I just saw a lot of gaps, which is what prompted me to go back to school, and I got a master's in integrative medicine, and I'm boarded in integrative medicine so that I know more about what a patient can be offered. And I still use conventional therapies when they're appropriate. It's just not my only tool.
I've got a couple ailments that I'm going to throw your way. If you can give me kind of the most common solution to all of them. So let's say there's someone at home who is low energy and tired all the time. What would you recommend?
I would start by asking a lot of questions about sleep, about nutrition, about hydration, about exercise patterns, about stress level. And then from what I learned, I would try to help that person either overcome or adjust in each of those areas. I'll just say that a lot of my patients come to me not sleeping well. They get 4 hours or 5 hours of poor quality sleep. A lot of them are on a sleeping pill already. And so I will combine sometimes we use herbals, sometimes we use medications, sometimes we combine them, or I even use some IV therapies in my practice to help take away inflammation of the nervous system. That often will help people relax. I use things like vagus nerve stimulators. I have a lot of patients that wear those to go to sleep, and it helps them stimulate the side of their nervous system that's getting overshadowed by fight or flight. It's called your parasympathetic nervous system, and you need that to be engaged so that you can rest and digest and relax and kind of renew and restore. So when someone is in a lot of pain or under a lot of stress, that side of the nervous system often gets overshadowed. So there are tools, even some of them are not medications, that we can give. I mean, very simple things. Many patients take magnesium, some take theanine, some have a little bedtime ritual that helps them wind down and engage better in sleep initiation. So you're exactly right. It is very individualized to each patient.
So I was going to ask, what about weight gain? That's another one.
That's a big one.
Can you give us some quick tips on that?
So when I'm looking at a patient, I like to ask them a lot of questions again. I found that most people have multifactorial weight gain, but if someone gains weight all over, that's often an insulin resistance issue, and they need support to overcome their insulin resistance, starting with learning what the person eats. Adjusting what someone eats would be the most basic foundational way of lowering insulin resistance, which helps with weight loss. When fasting insulin especially, is elevated, you cannot lose weight. You just cannot. It's like blocking the release of free fatty acids in the weight loss process. Some people will gain weight more in the middle, So the insulin resistant patient will gain weight all over. When people gain weight in the middle, it's more of a cortisol issue. So I know when I see someone that's relatively thin but has a large abdomen, that person is probably under a lot of stress. So starting to talk to the person about what's driving that, to help them see, are there, even if we try to help their body feel that it's less stressful, if the situation doesn't change, sometimes will help. And then the third one can be like things like hypothyroidism, or like inflammatory conditions. I mean, people who get mold exposed often will gain weight, I think, as a compensatory kind of adaptation, that it's just because they're so inflamed. So their metabolism sort of is secondary to just survival. And so when you look at each person and kind of size up where they're gaining weight, how they're gaining weight, and how it came on, that's kind of step one to look at how could we potentially reverse that.
You talked about mold exposure, and I know we're going to have someone else on that's going to maybe go into it a little deeper, but is that common, mold exposure, and people having symptoms to that?
It's actually everywhere. It's just certain people are sensitive to it, which might explain why you might have a household of people who are all exposed and only one or two of them are having any health issues. And it's kind of, this is an interesting thing. Patients will get online and they will diagnose themselves, and then they will come to me and say, I have this or I have that. I find most patients it's more complicated and it's multifactorial, but I always include that in my potential problem list, because if you don't treat that, then a lot of the other things we treat also don't really get better.
That
so
is
it is
an
very
interesting
common. It's just not that everyone is sensitive to it. It's there's sort of predisposing factors to have a sensitivity to mold.
I think, we're so busy, a lot of the time we kind of shoo off things that are going on with our bodies. Like, for instance, we wake up so early, so we always are like tired, dead tired, maybe at 2 o'clock. But what are some red flags that you listen for when you're talking to people? And those red flags would be like, okay, you should go to an integrative medicine physician. What are some of those things so that everyone in the audience knows?
Well, of course I'm biased, but I practiced regular medicine or allopathic traditional medicine before moving over to integrative medicine. And if someone just has maybe an intuition that they don't want to take prescription medicine for maybe whatever symptom they're having, an integrative doctor can look at them and give them a different approach. I spend a lot of time with my patients. Aren't like you guys. You guys are healthy and strong, and you're able to rebound even after you're sleep deprived. But over time, a lot of the patients I treat who have chronic complex illness are those overachiever, go-getter people who really expend a lot of energy and don't always adequately recover. I tell all my patients who I treat for chronic infections, probably they had the infection before and they just wore themselves down to a point where the infection had an opportunity to flourish, and then they become really ill and they have to rest to recover. So if you start craving sugar all the time, if you start craving caffeine, if you need a nap every day, probably there's something going on that could warrant speaking with an integrative doctor to try to sort it out before it becomes more of a severe health issue. And the further that someone goes down the road of chronic complex illness, the more challenging it can be to try to reverse some of those symptoms, although we do try it and try to work with patients like that all the time.
Okay, doctor, if someone at home is listening and they think, okay, I want to go visit you, where do you practice? How can they find more information about you?
So I am actually the current president of ILADS, which is the International Lyme and Associated Diseases Society. And I mentioned them because we have a large number of practitioners all around the U.S. and even in other countries who look for root cause or underlying cause in patients that have chronic illness. I'm located just outside of Austin, Texas, in Marble Falls, Texas. But it would be more meaningful, I think, for if someone is really looking for a doctor to look for underlying issues, if they went to ilads.org and went through the provider search option, they could find doctors or nurse practitioners or naturopaths or other clinical providers in their area and get a nice consultation where they could get more of an insight into what's going on with them.
Okay, thank you so much,
Thank
Dr. Amy
you.
Offutt. We really appreciate your time, and we'll make sure to post that somewhere so that people can go and get some more information. But yeah, we really appreciate you.